I wanted to talk to you about Malaasana today. Malaasana is just squatting, but there's a few extra steps to it. When you start, there's lots of health problems these days because we don't use the squatting position. So that includes all of those pelvic floor dysfunction issues like constipation, like PCOD, endometriosis. All of these can benefit from a regular practice of squatting, and that also includes things like low backache and even knee pain, because if your hips don't work properly and if your pelvic floor doesn't work properly, you can end up with knee pain or even shoulder pain. So, and the biggest factor in modern life that we miss out of movement is the squatting position, and the Malaasana is kind of a squatting position on turbocharger. So it's a much more effective way to squat. Now you can use the Malaasana as a snack, as a movement snack. So every half an hour, 1 hour or so, if you can squat in the Malaasana position for maybe 5 to 10 seconds or 20 seconds or 30 seconds, as your endurance builds, you can do more and more of it. You start to get proficient in that position, and your pelvic floor starts to work better. Once your pelvic floor starts to get better, working better, your breathing gets better, your shoulder gets better, your posture gets better, your neck, your hips, your low back, your knees, everything gets better. And so once the pelvic floor function starts to improve, all the congestion that you get in the pelvis due to various problems can also improve. Now most of the gynecological problems that you have are exacerbated by pelvic floor dysfunction. So when you have a lot of congestion, you can have a worsening of problems like PCOD, endometriosis, dysmenorrhea, or painful periods, all of those. So Malaasana is how you try and fix that problem. So this is the Malaasana position. So basically, shoulder width or slightly further apart. Try and keep your feet pointing parallel as far as possible. Get your elbows into your knees, inside your knees, and squat down. And from here, you try and get your forearms straight. So hold this position. Try and sit upright. Try and relax here. Don't hold tension in this position. And in this position, while you stay, I want you to breathe in and out. And when you breathe in and out, you should feel your abdomen expand when you breathe. When you inhale, you will feel your abdomen expand. When you exhale, you will feel your abdomen contract. Now the abdomen should expand and push against the inside of your thighs. Your flanks should feel like they're expanding, and your back should get a nice stretch. The insides of your thighs should get a nice stretch. So this is the Malaasana position. Once you start getting good at this position, you can sit for longer and longer. And if you interrupt your daily sitting in a chair for every 1 hour or so, if you can spend 20 to 30 seconds in this position, you would benefit quite a bit. So yeah, that is the Malaasana position.